Moving a national organization like Select Medical that operates inpatient settings providing post-acute care, rehabilitation hospitals, long-term acute care hospitals, and outpatient settings facing this challenge was certainly daunting in many ways. But Select Medical was built for these sorts of challenges. Since the beginning of this pandemic, 62 of our critical illness recovery hospitals, also known as long-term acute care hospitals, and our inpatient rehabilitation hospitals have cared for over 350 patients suffering from COVID-related illness. We knew that we had our work cut out for us, but we also knew that our collaboration and our approach to a continuum of care, now a COVID continuum of care, was vital in this context. We have a culture that is built on perseverance, drive, and commitment. The athletic trainer that drives from Maine to Michigan, our regional CNOs, 2 of them, driving one from Pittsburgh, one from Tennessee, to launch themselves into the fires that existed in Detroit and Flint, Michigan. Always understanding that barriers will exist, but we are able to overcome those challenges. We have learned what collaboration means and what true leaders, even without a title, mean. The collaboration between our outpatient colleagues and our inpatient colleagues to support each other allowed a very rapid transition, for example, of athletic trainers that supported a family communication pathway, allowing families no longer able to visit their loved ones to be communicating with an athletic trainer several times a day to get updates on their loved ones. We were called upon very early on in this pandemic, understanding that some of the large healthcare systems in the city of Detroit were under siege by this pandemic. We were called to action very quickly to act as a side stream provider, literally caring for the sickest of the sick in terms of COVID patients. We were beating the odds by working together. We were beating the odds by working in conjunction with our acute care partners. We were beating the odds by working across disciplines and across divisions.
Yesterday, as I was preparing to leave the unit with my coat and laptop carry case in hand, thoughts of tomorrow is Friday, as I walk down the hall, while my body somewhat feels like it has been Friday for 2 weeks. Suddenly, a voice rang out as I walked past 623, asking if I could assist her find her pillow speaker. Reluctant for a second, I had to catch myself thinking, I'm already sanitized and ready to leave. I don't have the proper PPE on. Should I find help on the floor? I realized in that moment our clinical team is just as worn and tired these days. So I dropped the stuff and put the proper PPE on and went into her room. We chatted for a bit. She told me her remarkable journey to recovery that this past month, one that speaks volumes of her determination and the level of care that she has received from healthcare professionals since day one. Her eyes welled up with tears when she told me it has been a month since she has physically seen her daughter and family, but she has been so grateful that Select has given her the opportunity to talk to her daughter via FaceTime, and just how much it meant to her, along with how appreciative she is to be alive and for all the care she has received from our nurses, doctors, and support staff that has helped her on her journey. I promised her I would come back and check on her again tomorrow. She smiled. I smiled. She taught me so much in those 10 minutes at the end of the day during this epidemic. Through all the challenges that all healthcare workers face, it is so worth it when you see, realize, and witness just why we do it and who we do it for.